we'll review that. I'll start with that, and then we'll have some math. Your favorite, I know. Talk about bowel elimination, and then Wednesday, I said tomorrow, Wednesday is going to be a review of everything, because your next exam is next Monday, a week from today, on the 11th. Any questions? If you guys been reviewing, studying, is there any questions that have come up that you're unsure about, or how are you feeling about content so far?
So there have been some questions in the practice exam about magnesium.
Okay.
I just didn't know.
We talked about magnesium.
Okay. And magnesium, isn't that dealing with muscle spasms?
It can.
Okay.
Helps with sleep now. Yeah.
Nerves, that's it, nerves, yep.
It's calcium's bones, potassium heart, sodium. Sodium's the muscle?
Sodium helps with like our neuro status, yeah. Yeah.
So magnesium, nerves, sodium, brain, potassium, heart,
Calcium bones.
calcium, bones.
That's a good way to look at it too. But we will review, we'll spend all day reviewing Wednesday. If you guys want to bring in some snacks or food or whatever and just chill, it's gonna be a chill day anyway, cause you're not gonna be learning new content, we're just gonna be reviewing. I will bring out the study guide like I did for the very first one. Take a picture of it, write it down, we'll go over it, come with any questions, and then we'll play a couple games. Well, I mean, we'll have time for sure, so. Does that sound okay? Alrighty. What is the main function of our urinary system? Yeah, so that's the main function. What's our main organ? The kidneys, yep. What are the little tubes that carry urine from the kidneys to the bladder? Ureters, yep. What does it mean when I say anuria? Without urine. If there is absent urine. Good. What about oliguria? Little, reduced. About how much in a day?
Less than 30.
Less than 500 mLs a day. Now 30 is what? 30 mLs per hour is the bare minimum. Good morning. Good. What is your patient gonna look like if they are experiencing oliguria?
Swelled edema?
Maybe, yeah,
Belly distension?
potentially. Are they gonna be warm and flushed? Are they gonna be pale? They're gonna be pale, yep. They're gonna have clammy, cool skin. What about their blood pressure? It'll be low, yep. Good. What about polyuria?
Frequent.
Too much, yep. Frequent. Nocturia.
Nighttime.
Yep, excessive urination at nighttime. Dysuria.
Painful.
Painful urination. Hematuria.
Blood urine?
Good. How would you define stress incontinence?
Like if you sneeze?
Sneeze, coughing.
What?
That happened on our shoe at clinical. We're trying to get this little lady at the potty,
Yeah.
and we had her taking her street off, and when she went to go squat, she just poured all on the shoe. You didn't tell me that happened.
I'm sorry.
Fine, I was really grateful for the shoe boy stuff there.
Yeah.
There's no holes in it.
Yeah.
Yeah.
That's wise, yeah. So how would you describe that then? How did she lose
Incontinence during
during activity? Yeah.
Just water.
Squatted down, jumping, laughing.
I was gonna say sneezing and
Sneezing.
Okay.
Yeah. What about urge incontinence?
Like you can't feel that you have to go.
You have
It's
a
a-
strong sense
Oh,
to
opposite.
avoid. Yeah. What about mixed?
It's
It
stress
could be.
and urge.
Stress and urge. Yep. Overflow.
Incomplete bladder emptying, which means you're constantly gurgling.
Yep. Temporary incontinence. What can cause that?
Infection,
Infection,
Constipation.
constipation, potentially surgery, but we don't want that to be, that could be like right after surgery, but we don't want that to be like a long-term effect of surgery. Good. What about urinary retention?
keeping your bladder.
There's urine in the bladder, you have a hard time fully emptying it. What's the difference between chronic urinary retention and acute urinary retention?
One is sudden, the other one's long-term, it's been happening for a while.
Okay, which one's a medical emergency?
Acute.
Acute, yeah. What does nocturnal enuresis mean?
Bedwetting.
Bedwetting, yep. What are some psychosocial factors that we have to take into consideration with patients and voiding?
Dementia.
Okay.
Privacy.
Privacy. We want to provide privacy as much as we can, as safely as we can, okay? What kind of muscle exercises can help strengthen that? The Kegels, yep. What is the most common bacteria that we see that causes UTIs?
E. coli.
E. coli. In who more? Women. What is a urostomy?
It's a urinary ostomy bag.
Urinary ostomy bag where they're not, the urine is not coming out their urethra, it's coming out their skin on their abdomen, okay? Can I just let it go? Just like let it drain?
No.
No, why? I can't control it. I can't hold it. And also I don't want that skin to be damaged around the ostomy, so there always needs to be a bag. What is our classic symptom in older patients
Confusion.
of a UTI? Confusion, yes, good. When I am assessing urine, what am I looking at or for?
Color.
The color. What color do I want it to be?
Light yellow.
Pale yellow. What about if it's red?
It's got blood in it.
Probably got blood in it, yeah. What if it's, dark?
It's probably dehydrated.
Probably dehydrated, yeah. What about orange?
Medicine.
Medicine. Yeah. And apparently asparagus can turn it green, too. What else are we looking for?
Smell.
Clarity.
Smell,
Sweet smell.
sweet smell could tell us what?
Diabetes.
Okay. What else? What other kind of smells? Strong, malodorous odors. Yeah. Bad smelling stuff. Clarity. What could we see? Particles, sediment, clots.
Cloudy.
Huh?
Cloudiness.
Cloudiness. Yeah. And then one other thing that we're looking at. The amount, yes. And what is our normal urinary output per hour?
30
mLs, yeah. What kind of lab tests could tell us kidney function?
Creatine and the
Our
bottom.
BUN and creatinine, yep. What does BUN stand for?
Blood urea.
Blood, urea, nitrogen, good. So we're also checking whenever we're doing different lab tests, we're checking the urine for protein. What could, show us about protein? Like, what are we concerned about? If there's protein in the urine.
The body's not utilizing it.
It's not utilizing it, okay. What do we see that in? What kind of patients do we see that in? Pregnant, yeah. What'd you say? Potentially different diseases, yeah. We could also see it if a patient has a fever, if they have exercised recently, and different diseases. We talked about the sweet smelling. What would we be testing for if we're worried about diabetes?
Glucose.
Glucose in the urine, yep. Ketones, this indicates fat has been broken down for energy. That's not good either. Good. What is a normal pH of the urine?
6.
Six.
Like,
Yep. So if I have a large amount of ketones in the urine, what could that indicate?
Fat's broken down.
Mm-hmm. If it's bad enough though, what am I worried about my patient having?
Oh,
UTI?
keto.
Yes.
Ketoacidosis.
Ketoacidosis.
Diabetic ketoacidosis, yes.
I couldn't pronounce it.
I got you, I got you.
That big word.
What is a culture and sensitivity test?
I'm gonna send it out, like if you get a rapid back and it's normal, but you're having symptoms that present as some sort of infection, they can send culture and sensitivity to figure out antibiotics.
Yes. They're figuring out what exact germ they're dealing with and figuring out which antibiotic is going to best help that. Yes, good. Talk me through a 24-hour urine collection.
Catch a midstream.
It starts whenever you pee the first time when you discharge the first one.
Okay, so it starts whenever the morning, like if I'm starting at 7 a.m., I go to the bathroom and don't collect the first one, right?
Mhm.
And then I collect every single amount afterwards. What happens if I forget one?
You have to restart it.
Okay. Can I just keep it beside the commode?
No.
Stay on ice for
It has to be on ice or has to be in a fridge, not with food, but has to be cooled. What about if something happens where I get stool in the specimen?
You have to start over.
Start over. Yep. What about some diagnostic exams? What's the one that I look at? We look at vital signs, okay, but ultrasound, okay. X-ray, what kind of what specific X-ray? What's it called?
Gas.
There's kidneys, urinary, and
KUB, kidneys, ureter, and bladder. That is going to give you a good picture of the entire abdomen. Okay, you might see a question about that. So, KUB, kidneys, ureter, bladder. What's another test we could do? It's also 3 letters. An IVP, an intravenous pyelogram. What do I need to ensure before this happens though? What could my patient not be on? Metformin for how long? For 48 hours before. So I need to make sure that they are not on metformin 48 hours before. And that, what are we worried about allergy-wise? Iodine. We need to make sure that they're not allergic to iodine. How long do they need to be NPO for? Like 8 to 12 hours before. Yeah. And then, what's one other thing that we need to potentially use to get a clearer picture?
Dye.
Well, we're using the contrast, yeah. But what might block my view?
Edema?
Air or what? That they're about bowels need to be cleaned out, so they might need to have a laxative or enema to make sure that the bowels are empty. Good. What's the procedure, where they insert the camera in the urethra? Yep, cystoscopy, yep. It's a hard word, it is. Good. What are some interventions that we could implement with patients that have difficulty voiding or, stress incontinence or things like that? Put them on a schedule. Yeah. How would I do that? Take them every 2 hours to start, on the dot if we can, and then how do we progress?
Get them to start taking themselves.
Try to help them to be more independent, and then maybe adding an hour onto that so it wouldn't be as frequent sometimes. Yeah. Encourage fluid intake, exercises for the pelvic floor muscles. If my patient has a hard time getting up, going to the bathroom, what is my next best thing? Bedside commode. If they are unable to get up, bedpan. Yeah. But when I am using a bedpan, what do I want to make sure my patient, how do I want them to be positioned?
Upright 90 degrees.
I want them sitting up as close as we can mimic, the regular bathroom, okay? You can't expect a patient to go to the bathroom laying down flat.
Mm-mm.
That's just not gonna work. How can I appropriately monitor intake and output?
Check their trays, if they're taking a skilled nursing, try
Uh-huh.
to finish their meals and report it.
Okay, and how much they have drank, yep. Okay, how can I monitor output? What is output?
Elimination.
How much they have voided or
Eliminated bowels.
with their bowels, with, emesis, blood, there's different things that we could monitor output for. But what are the different ways of collecting urine?
A hat.
The hat, urinal, bedpan, yeah. How can I teach my patient to prevent UTIs? Good hygiene, especially for who?
Women.
And what kind of
Front to back.
front to back? Yep. What else?
Not holding your bladder, going when you
Do
have
not hold it. Yep. You go as soon as you feel the urge. Who's more at risk for getting a UTI in the working profession?
Healthcare.
Healthcare workers.
Why?
Cause we don't think
You
so.
don't get to go to the bathroom as often and you have to hold it all day. Yep. How else can I prevent UTIs?
Why would we pray for that?
Encourage fluid intake, at least 8 ounces or 8-ounce glasses of water per day. Avoid tight clothing. Educate them to take showers instead of baths. And then if something happens where they get a UTI, what is something important we need to educate them about antibiotics?
Take them consistently.
Take the whole amount. Doesn't matter if they're feeling better, they need to complete the whole amount. Good. Alright, let's talk about Foley catheters for a minute. What kind did we talk about Wednesday?
Kudos.
2 days? What is that?
That's the one that's the
It's
curved
curved,
tip.
yeah. Who do I use that for?
Prostate.
Enlarged prostate. Mm-hmm. Yeah.
Straight cast.
Straight cast, what do I use that for?
In and out.
In and out. Okay. So it doesn't actually stay in place, there's not a balloon. Okay. What others? Just two more. The Foley. How would you describe that one?
Is that the one with the balloon?
It is the one with the balloon. Uh-huh. How many ports does the Foley catheter have?
Two.
Two. One is for
Blow
the balloon, and then the other one is to drain the urine, okay? And then the three-way catheter, that one still has a balloon, right? Okay, but why do I have three? Fluid going in, urine coming out, and for your balloon. Good.
What's that one called again?
Yeah, three-way Foley.
Okay.
It's just called a three-way, yeah. With a three-way, do you think the catheter size is going to be smaller or larger than your normal catheters?
Larger.
Why?
You're pushing fluid in.
I'm pushing fluid in and out. What else might come out with those fluids?
Blood.
Clots. What would happen if your patient has a catheter, but they say, I really feel like I have to pee, I feel like it is just I'm about to pop.
Bladder scan.
I'm gonna bladder scan probably first, but do I ever wanna just take the catheter out and put another one back in?
No.
No.
Terrible idea.
That is unnecessary, and we are putting them more at risk for infection if we're doing that. I'm going to check for any kinks or anything that might be stopping up the line. If they have a three-way and I know that I'm not seeing anything come out, but they're saying I feel really full, my bladder feels really distended, what do you think you're gonna have to do after that?
Flush it.
Manually irrigate it, probably. Yeah. Why do we have to use catheters?
They're not able to void on.
If they're not able to void on their own, they have the urinary retention.
It's usually for critically ill that need, regular eyes and O's.
Yes, for your critically ill patients that need the very accurate eyes and O's, okay? Sometimes for surgical procedures, sometimes to help with the peritoneal wound healing. And then sometimes we just use it for comfort at the end of life. So those are internal catheters. What about external catheters? Condom calf. What else? Curewix, or what else?
Primas and Primos.
PrimaFit or PromoFit. Yeah. How do those work? By suction. Yep. Yep. Good. How often do they need to be changed?
8 hours.
Every 8 hours. At least once a shift, if not more. Okay. How would you educate your patient on collecting just like a routine urinalysis? If they're able to go independently and do things on their own, how would I get just a routine urinalysis?
Tell them to clean properly and catch midstream.
Okay. If something happens where they might need a little help, could I use a urinal or a hat?
Mhm.
Can I use the same one that they've been using?
No.
No, I need to get the clean one. Yeah. Now, if I'm getting a culture and sensitivity test, I definitely want to use the clean catch or midstream method with a sterile specimen cup. Could I get urine from a Foley?
No.
Unless you just put it in.
I can get it from just putting it in, but could I get it from the bag? No,
Mm.
it's not considered sterile at that point, right? Okay. Good, good. How do we feel about that?
How did you get the urine?
Say that again.
How would you test their urine?
So, I believe, and it might just be different with every facility, but, most Foley catheters have a, kind of like a port thing near the top of the tube, closer to the patient than the bag that you can
That's
draw
what my
urine
facility
from?
does, they
Okay.
do the second tube that you can empty it from that, they have the balloon one and then the other one, and they use
Yeah.
that one to get the.
Yeah.
urine.
It just depends on your facility. But if you know that you need a specimen, go ahead and just get it. Save yourself some trouble and, get it. Most of the time, they do want one. Is that locked?
I don't know, I feel like I focused a lot more on the electrolytes than I did the urine.
Well, it's okay. We'll go over it all